Our EMS crews are available 24/7, 365 to respond when needed. Each crew works 2 to 3 24-hour shifts per week. Every day they come to work not knowing exactly what to expect during their shift because every day is different. Their days may have times that are rather mundane with not much happening. It's during those times that they may grab some periods of rest. Remember, they are on shift for 24 hours. Everyone needs rest during that length of a shift. This down or rest time is nice, but at any given moment, that could all drastically change.
Station A, respond to Wabash General Hospital, 1418 College Drive.
The crew's days may erupt in a rush of calls that require them to spring into action to respond to a medical emergency, a traumatic event, or even a transfer from our local ED to a higher level of care facility or a specialty care facility. They might stay tied up nonstop for the next X amount of hours responding to and caring for someone having a heart attack or a child having seizures from a high fever, someone seriously injured in a car accident, someone in respiratory distress from COPD, someone having a stroke. The list of possibilities is endless. This load is lightened and enhanced having 2 full-time crews on at all times. Wabash General EMS averages about 1,700 calls per year, which translates roughly to about 5 calls per day. Our EMS crews begin their shifts at 6 a.m. each morning. During the first hour, they check the ambulances to make sure all the equipment is in good working order. They check to make sure all the necessary supplies that they might need on their shift are on the ambulances. They clean and disinfect the ambulances and the station to make sure both are clean and ready for the day. In addition to all this, after each run, the crews will clean and resupply their ambulances so they can be ready to respond to the next call. Once the truck is back in service, crew members will document what happened on the run on an electronic patient care report. Depending on the call, this could take another hour or more to complete. Once that report is completed, then the crew will fax it to whatever hospital they took their patient to. It then becomes a permanent part of that patient's medical record. At times, crew members may even go next door to our hospital's emergency department to help them with triage and/or treatment of their patients as needed. At Wabash General Hospital, we are a family throughout the healthcare spectrum, and we all do our best to help each other in order to improve patient outcomes. EMS is never a dull moment. It's a very rewarding way to serve our fellow human beings in what may be the worst day of their lives. If we can help make those days of our patients a little better by helping them feel better physically and or emotionally, or by getting them to where they need to be for more definitive care, we consider it a win.